Wichita is not the biggest city in America, but it's one of the larger cities in Kansas, so it has a large, a diverse population. We have a lot of suburbs.
We have 2 times the national average as far as our diabetic population, which is one of the reasons that we chose to get involved in Project Impact. We're trying to make a healthier workforce, and that's a work in progress every day. We have a lot of different health issues that we're trying to tackle, and really a diverse group of people.
I think what we see now is an uncomfortably large percentage of unmanaged diabetes, where we have diabetics that aren't really keeping their condition under control, and it's leading to things like amputations and renal failure, kind of the worst possible outcomes.
There's people that slip through the cracks. There's a lot of misunderstanding, and we find out from the physicians. They come to us and will ask questions about their medications. Also, not understanding what medications are actually covered and their insurance benefits, those type of things.
We have kind of long, cold winters. The summers are kind of hot. It's sometimes not pleasant to be outdoors and to be physically active. We're right in the middle of the heartland here. We love our beef. We eat lots of it.
I actually have one patient right now. She's part of the Wichita Public School District that told me she no longer goes out to eat with her friends. And that makes me sad because she feels like that if she goes with them, everyone judges what she eats.
And so what happens in the caregiving professions, whether it be nurses or teachers or whatever, is they neglect themselves just tremendously because they're caring and taking care of others. And then, unfortunately, when they need care, they need a lot of care.
You have physicians that they don't want, this is my patient and I'm following their care. But then you also have other patients. And we're new into the Wichita area, Wichita market with this study. And so hopefully we'll be able to break down those silos.
What we found early on is that the providers, especially the physicians and the employers, never talk to each other. So that was a really important dynamic. And I've been very upfront about this. Our members, you could say that half of our members' costs are the other half's revenue.
I just didn't realize how bad I was feeling until after I started feeling better. My energy level, my moods are better. I'm more consistent. And I feel my mind is much clearer. I am able to think better than I could before. And I didn't even realize that any of that was being affected.
I've already had 2 of my patients that were not checking their blood sugars at all. One of them hadn't checked for 5 years, and I said, well, what do you tell your doctor when you go in for the visit? And she said, I just make up numbers because I know what they want to hear. So I was happy that she had a relationship where she trusted me to confide that in me, but I was very sad to hear that's what she was doing. And so we sat down, we got out a glucometer, we walked through it. Now she knows how to test her blood sugars.
My husband and I have already agreed and has started in the last 2 weeks fixing our food at home. We ate out a lot, and I've been taking my lunches to work. Then I can stay away from the cafeteria, and I don't have good food to begin with, and then secondly, it's just better food, so I feel much, much better.
I was not aware that pharmacists had, the capability to help at that level and to provide that, degree of interaction with their patients. So I was surprised to learn that. I think the pharmacy is a great setting, though, to reach people. And I'm just optimistic and hopeful that it will make a difference.
I'm hoping that we can really show not just more physicians recognized, but that we can actually show that the practices run differently. It's a proactive approach to saying, have we done the right things for this patient? Not just, are we going to meet that patient's needs for what they came to see us for today?
I mean, we can look at A1Cs at a certain number, but an A1C is going to be different for each person. And so my target is not a certain A1C, but it's for a total health of an individual that engages in their family, engages in their job, and society.
And I never imagined in my mind that we would be taking patients into a room and talking to them one-on-one you know, it's really exciting to be a part of that. And so now we're finally seeing what they kept saying was going to happen, and we're really doing it. So it's exciting.